Doctors at Palomar Medical Center are upset over a new contract. Palomar Health is the North County's largest healthcare provider, and doctors say it is prioritizing profit over patient care. KPBS's Alexander Nguyen has more.
For more than 40 years, Vituity has been providing Palomar Medical Center in Escondido and Poway with emergency room doctors. Now Palomar Health is going with a new company. The hospital says the change will help improve patient care, and the savings will help pay for new equipment such as CT scanners and MRI machines. The doctors who work here aren't too sure.
Palomar Escondido Chief of Staff Dr. Sabiha Pasha says the changes is more about money than patient care.
And buying MRI machines and CT scanners, sure, if we have the money, we'll do it. But you don't do it at the cost of jeopardizing that core business that we do. And that's the business of taking care of people.
The new company is called Emergent Medical Associates, or EMA. It will provide Palomar with ER doctors, hospitalists, and intensivists. There are doctors who take care of patients in the hospital after the ER. Dr. Pasha says EMA plans to increase doctors' workload, and that will affect patient care.
They brought staffing model that would require each physician to see 25 patients a day in a 12-hour shift. So you do the math on that. Less than 20 minutes per patient, and then you have to do all your documentation. How do you take care of sick people like that?
For the most part, hospitals in California are not allowed to directly employ doctors. Instead, they go through a third party. Dr. Pasha says the current provider has been doing a good job, and she doesn't understand why the board decided to change provider.
In a statement, Palomar CEO Diane Hansen admits the move was about money, but says it was made with patients in mind. She says EMA's proposal allows us to retain all our staff, plus reinvest saved resources to upgrade patient care. In an email, EMA President Dr. Irv Edwards says no cuts or changes in staffing are planned. However, he says there is a plan to increase efficiency and quality over time using proprietary management tools we have developed. EMA says it will keep things running the way they are for 90 days. Afterward, it will reevaluate and make any necessary changes. And that is what worries Dr. Pasha. She says the majority of the more than 100 doctors at Palomar are not planning on signing with the new company.
That says a lot.
EMA says it already has commitments from 50 or so doctors.
The contention over the contract has led the staff here to issue a rare vote of no confidence against Palomar's board of directors. In Escondido, Alexander Nguyen, KPBS News.
Palomar says the changes will only affect doctors who work exclusively at the hospital and won't affect family doctors or specialists. The new contract goes into effect on August 1st. It's unclear what will happen if the majority of doctors refuse to sign with the new provider by then.